I've had 3 kids through the school and 2 in middle school. And everybody's been vaccinated but the 11-year-old. And so I'll leave with that. So I wanted to update just a little bit about what's the current conditions. I appreciate that we only have 22 kids out. There's going to be a little bit of information bias because kids aren't going to necessarily always be tested. And so I appreciated that we used the thresholds to see how many kids were out and how many kids were sick of other things and did that. Mr. Shimmick, I like what you said about the thresholds 10 years ago. They did that. They did have that, and I appreciated that. I think Dr. Dick used that a little bit for this school year to do that, to say let's have some local control. And so what's local control? For instance, in the Panhandle, we were in a bubble. We were in a bubble until just before Labor Day. And Dr. Dick and I had talked, and I talked to the superintendent down in Gehring. We were in a bubble. It was a bubble, it was a bubble, it was a bubble. It was done. We're no longer in a bubble. The incidents didn't come up. And so locally, we've seen an increase in cases. I see a positive list every morning. We've seen from little kids clear up to 90-year-olds have COVID. And that's what the public health will tell you as well. And so it's not a descriptor of who's going to get it. Somebody's going to get it all the time. It's always going to be around. We need to learn how to live with it. And I'm going to put in a plug to say that mandates are difficult because when you tell someone to do something, particularly your child, they may not always do what you tell them to do. And so that is something I think we've got to remember about the public. Because I like what Dr. Donahue has said before, and then Mr. Blomstead has said here, there's a layered protection. The mask gives you a layer, distance gives you a layer, hand hygiene gives you a layer, vaccine gives you a layer, distancing gives you a layer. When you look at 100 years ago, what they were telling people to do in the pandemic, get fresh air, ventilate. They enhanced the ventilation in school to make it better for the kids. You did the enhanced cleaning that kept the cases down. And then vaccines are coming, and the vaccines aren't for everybody. There's some people that shouldn't get it, and there's people that will get it and people that will be against it. And so we have to learn how to live with that. And I'm very much a believer that our kids do need to be in school and not behind a screen as well. And so that's my update. I'll certainly take questions, and I know Paulette and Kim are on the line as well.
Does anyone have any questions right now, or will you be sticking around?
Sure, I'll stick around.
In case we need to have some more questions.
Do you want us to hold it, or do you want to let them present, or ask questions then?
Would it be specific for Dr. Bruner, or
Yes.
something then please do?
So Dr. Bruner, I guess one thing, as we sort of struggle with this question of, what do we do with our kids? Because obviously that's, I think all of us here are looking at how do we keep our kids in school, how do we keep them as healthy as we can. I guess what would you say to a parent who maybe feels that masks aren't necessary? What would you say to a parent who feels like we should be masking everybody? I guess I'm asking you to take both sides of that question, and as a medical professional, how would you answer those two parents?
Well, let's take it as an easy question. When are masks going to be very important? When you're sick. I'm sick tonight. I don't have COVID. I was tested, I promise you. But I don't want to get anybody else sick. So that's easy, right? It's easy when you're sick. The trouble with COVID is there was 2 days ahead of symptoms that you could spread it. And it was just a little bit more contagious than the regular flu. And so that's what scared everybody. And so let's look back. What did my kids do? Well, my kids did the mask mandate like they were supposed to. When the mask mandate lifted before they were vaccinated, I let them take the mask off because that's what they wanted to do, and that's what they were geared to do with local incidents. We went on vacation in this summer. We didn't wear a mask. We were outside. We did those kinds of things. My kids went to school, did not wear a mask. As the incidents rose, I had a little bit of insider information. The incidents rose, I said, you guys need to probably put your mask back on. What they do, they wore their mask. How many kids wore a mask? Well, not very many, Dad. Did they make fun of you? No, nobody made fun of me. And that's the point we need to get to, is where the people who want to wear a mask and be comfortable with that aren't made fun of at school because of it, and vice versa. There doesn't need to be bullying on the other side. And that's what we need to get to as a public, is that let each person make their choice. And then as an incidence, if you start to see people around you getting sick, then you probably better put more masks on. But if the incidence isn't there, then the masks really aren't going to be anything more than a hindrance to some of those things, as I talked about with the speech pathology and And my daughter works at the Westmore as a para, and she talks to me about some of those kids that needed the face. They needed to see that because of their autism. And that struck a nerve with me, that that's important to be able to do. And so what does she do now? Well, that kid's got to be protected, so they'll step back, take the masks off, have some on-mask time, then put the mask back on. That's responsible, and that's what I would tell a parent to do.
I think my question for you is, I feel like last year we had a lot more directive as to, okay, 6 feet apart, wear the mask. If student X is sitting here, the people around student X need to quarantine unless they're both wearing masks. And we had the whole diagram that Melissa had prepared for everybody. We don't have that now. And it doesn't seem that the school district is doing that. Do you believe that there should be social distancing?
I think there needs to be a little bit of distance, but I don't think the 6 feet is it anymore.
Okay. Do you believe that masks are important when there is 20 kids in a classroom and there's one kid who's COVID positive?
So there's one kid that's COVID positive, yes, it becomes important. But it also depends on what that kid's doing. So there's something called an aerosol generating procedure. So we know that in healthcare. Aerosol generating procedures, think intubation, think somebody on high flow oxygen, where they're blowing stuff out, coughing, sneezing, those kinds of things. That's when they get the aerosols spread. Quiet breathing in a classroom isn't going to be an aerosol generating procedure. That's where the length of time came in. Singing in church is an aerosol generating procedure. Saying the pledge, saying some of those kinds of things. Then, you know, the band, that was an aerosol generating procedure. But you have to realize that's true for every virus. That's not just with COVID. And so the University of Nebraska did prove that it was aerosolized. It's not just droplet on things. It's not just with big droplets like if you would sneeze or cough, but it was small droplets. The World Health Organization uses a meter as the distancing, not 6 feet. UNMC would say 12 feet. Some people would say even further than that would be important. But what we saw last year with that is we still had low numbers. And what we've seen in the first few weeks of classes is we still have low numbers, all things considered. All things considered with the number of kids that we have in staff, we have small numbers. Lincoln saw 1,000 people out. But then they said on the stakeout, well, but that was still less than 5% of our students. And they were okay with that. 1,000 students, holy cow. That'd be a huge part of our district. And so, yes, distancing is important. Masking can be important. But so is the hygiene. So is that early identification if you start to have an outbreak happening.
Do you follow Dr. James Fowler?
Yes.
Okay, and were you present during his telephone or his web
No, I didn't catch
thing
that.
today? Okay, he talked about how the Delta variant is way more transmittable than the COVID from Wuhan. Do you agree?
So it's 50 to 70% more transmissible. And the original strain of the Wuhan virus was one got 3 to 4 people sick. So one gets 6 people sick with this one. So yeah, but if you look at the measles and chickenpox, you get 1 in 12, 1 to 15. And so as all viruses, this isn't that contagious of all things.
Well, and those other viruses are vaccinated against, isn't that correct? So you
They
can
are.
go to school.
Mhm.
Okay.
Yeah.
So now, in regards to the Delta variant, he talks about that number one thing that schools should do is wear masks. And Dr. Lawler is an infectious disease doctor, is that correct?
He absolutely is.
And he says today that what needs to be done is schools need to have masks. They need to distance. They need to isolate and quarantine. There needs to be testing, which he has identified that Scottsbluff is a issue. The Panhandle in general is an issue with testing. He made that very clear, not only today in the conversation, but also previously that was in a Star Herald article. How do you justify saying, well, maybe masks aren't important when the infectious disease doctor in Nebraska is saying very clearly in his communications today, kids should be masked.
He's looking through it from a lens from Omaha and Lincoln, where kids are packed in, where their population is packed in, much more than ours are. When they look at the rates of vaccination, they do not take into the per square mile population. They look at, we're at 40% for our county. They interviewed last summer somebody who, or I guess it was earlier this year, that wasn't vaccinated, who was out cabbing and doing stuff. He's like, well, I haven't seen a person in 3 weeks. They don't take that into account. Now, are our kids packed in? Yes. Are we more than that? Yes. Are we more than Alliance? Maybe. Bridgeport? Yes. Absolutely. And so we can do those things. But mandating those things is a whole lot of different thing than saying that those are recommended. And our view is to get all of the population as safe as we can.
I guess I don't understand how that correlates, though. If you're saying with the infectious disease doctor, Dr. Lloyd Lawler, who's saying schools, it's simple, mandate masks. Then we have the commissioner who says we are recommending that all kids be masked. I guess I just have a hard time justifying the conversation of, well, we're not Omaha, we're not Lincoln. Well, we still have 20-some kids in a classroom together, which is what the issue for masking is. So how are you saying that that's not important in Scott's Bluff?
I don't find it important to mask people when there's no incidents in the classroom. The Westmore classroom had an incident in there, and so it made it important to mask that. That also was an outbreak of a kid whose family sent him to school when they were all sick. So you've got to stop that. It's not that the mask would have stopped that. Because we still had people that get sick with a mask in place. And so a mask isn't the last chink in the armor. It's just one of the pieces.
But the other pieces are distancing, which we don't do. The others are testing, which Scottsbluff and the Panhandle, again, there's issues with the testing. So all of these little chinks, wouldn't you agree, the Panhandle is not as aggressive as Lincoln and Omaha, where they have the testing. They are doing the distancing. They are requiring masks and doing all those types of things. I guess I'm just trying to justify how, just because we're a small town, we shouldn't be doing those things.
We have plenty of testing. I'm not sure what you're referring to with testing.
Okay.
We have lots of testing options here, and we're actually looking to expand those. So we do have testing options here for the whole population. I would continue to say that they didn't mandate masks when they started either. And they even at the west side schools where there were the UNMC docs, they didn't mandate to start with. And so then they changed their tune a little bit to do that. But their local incidence was different than ours. We have been in this bubble, and I'm going to tell you that it's still local incidence that should drive whether a classroom ought to have a mask or not.
Well, when I see 30 kids in our school district, 30 kids as of Friday, because that's the numbers that we had as of Friday.
Mm-hmm.
And in 2020, when you look at and you can probably pull it up if you wanted, the public health detailed data graphs as of October 1st in the Unified Command, it shows that in Scottsbluff County, that the cumulative cases for 0 to 9-year-olds was 9. 9 cases in August. The cumulative cases in September for 10 to 19-year-olds was 68. So a total in August of all of the Scottsbluff County, not Scottsbluff Public Schools, Scottsbluff County was 77. For September, the totals were 12 cumulative cases for 0 to 9. So only an increase of 3 students from 0 to 9 got COVID from August through September. Then 86 for 10 to 19-year-olds, so a total of 98. The total number of new cases from August 1st through September 30th was 21 cases. We have, as of Friday, 30 active cases. That is clearly an increase in the amount of cases that we have, especially with the Delta variant, that is much, I think you would agree, much deadlier, easier to
I wouldn't
transmit.
say deadly, but more contagious.
And the symptoms are more, would you agree that the symptoms are worse for the Delta variant than they were for the Wuhan?
No, they're bad no matter which side of COVID you have. And I would dare say that we had less testing a year ago than we have now, and so we have more bias in testing. We got Test Nebraska, and that increased our testing capability, but people didn't want to get tested because they didn't know that it was there. We had much more rhinovirus at this time a year ago before we actually had COVID here. And so our peak is hitting sooner here this year than it did a year ago. We're more where we were in October, late October to early November than we were last September.
Dr.
As far as
Lawler,
local incidents.
Dr. Lawler disagrees with that statement that we're starting the peak now, opposed to what he said today in his I don't know, that's briefing was that it's just starting and we are going to see a total wave of new cases that are going to start. So again, why, I guess my question is, we have more cases now. And last year when you came to talk to us, you said mask up those kids.
Because that was our only tool that we had. That was our only tool that we had. Now we have vaccines. And the vaccines for the 5 to 11 should come in October.
And I agree with that. And let me clarify. I'm talking about pre-K to 5. These kids that cannot get vaccinated. You know, that we can get into the vaccination. I don't think that's going to go anywhere. I'm talking about for these kids, pre-K to 5, when there's no other options. We don't have vaccinations. We don't have the same things that older kids have. How is it different for you to say pre-K through 5 a year ago when there were not as many cases? Yes, you mask up. Let's get these kids masked. And now there's a heck of a lot more cases in just our district than there were a year ago. And you're saying, oh.
We know more now. We know more how to treat it. We know more how to prevent it. Just because masking is there doesn't mean it's the best thing there.
So what's the best thing for these pre-K to 5th grade?
To not be afraid of things. So we are teaching them to be afraid of things. We taught everybody to run away from this. And now we need to teach them how to, let's be respectful. Let's wear masks when we're sick. Let's not go to school when we're sick. If the household is sick, let's not send this kid to school if we can help them. Let's test when we're sick. That's fine. But what's successful is continuing the school year, not taking out a whole classroom. So that's where the thresholds come in. But teaching everybody to run and hide with a mask on doesn't necessarily help them at all. I understand what you're saying. There's less incidents there. There's this thing, this multi-system inflammatory disease that kids can get post-COVID, and we saw some of it here in the Panhandle, and that happens. We see kids that get sick with it. We see kids, especially with special needs, that have decreased immune systems, and we want to protect them. Same thing that we wanted to do with our old and our frail. We wanted to protect them and keep them from getting the virus. And they got the vaccines first, and we protected them in the nursing homes. But the vaccine doesn't prevent infection. It's still like a cold virus. It prevents the hospitalizations. And so that's where that's so important. The vaccines, less than 1% of the people with a vaccine will end up in the hospital. That's what's important. You can still have a 15 to 20% chance to get a virus, even with a mask on and vaccinated. And so it does not it's not the last thing. And so to mandate it and to alienate that half of it, I mean, you guys put it up there, how many people don't want it. That's a very difficult thing to sell to people. And I understand what Dr. Lawler had to say, but the stats also show that their acceleration has plateaued back east. And that was as of last week, and it's continued, that it's plateaued the number that they add every day. So they are peaking, even though he's saying that there's still more to come. I understand what he's saying. He wants everybody to get on board and to stop the wave. That I get it. But we've also seen that it's peaked over there over the last several days, despite what he said on the news today.
Okay, so the infectious disease doctor says wear masks in schools. I want to say, what harm is it if you are correct that we are in the peak right now, what harm is it to mask up our pre-K to fifth grade level for a month? Get us through that peak that you call.
Go right ahead. We were told last March we're going to hunker down for 2 weeks. That's what the public is going to see. We were told last March to hunker down for 2 weeks and then it'll all be over. Now, a year and a half later, we're debating at a school board meeting whether we should have masks or not. And so, yes, I think if you do something for a short time, 2 weeks, we usually peak 10 to 12 days after the eastern side of the state did. That's what we did last year. That's what we did with the other peaks that happened. And so if you wanted to say, yes, for the next 2 weeks, 3 weeks, 4 weeks, whatever you want to make it, fine. But have an end point to take it off.
Understood.
Because that's what didn't happen last year with the kids, is it finally got to May before it ever came off.
But wouldn't you agree that's because the dial that everybody in the state was going off of had us in the higher levels, and it made sense to keep these kids masked? Especially when that's what was dictated through the state.
And one of the dial points was percent positive, and so the number of people testing went down, and so the number of positive went up percentage-wise. And so it wasn't really the same number of positive that had been there. So you really look at the incidence per 10,000 or 1,000, whatever you want to do, rather than percentage positive. And that's what kept our dial high. Was there a risk? Yes, there is risk. And that's Mr. Ship's point too. There's risk in everything. We have to teach our kids when to take a risk, when not to take a risk. And forcing it on them is a whole different thing.
So what does our hospital have in regards to capacity to take care of pediatric children that get real sick? Here in Scottsbluff, what capacity?
We take care
do you
of
have?
sick kids, and we also take kids to Denver who are really sick.
What is the capacity for Scottsbluff? For
We have capacity, it changes day by day because of our staffing and the number of people that we have in the hospital.
Give me an idea.
I'm not going to give you a number.
Can you talk specifically about how we can care for sick COVID children that are in hospital? That's an important point.
Yeah, so we have breathing treatments, we have oxygen therapy for them. Very, very few kids get intubated with us. And in fact, one of the treatments for COVID for all spectrums is to stop intubating them because it was the barotrauma of intubation that was actually so deadly at the beginning. We learned that out of New York City. And so it is very conservative therapy, running oxygen for them. Things such as ECMO and bypass and things like that, it's going to be huge centers that do that. We have physicians who practice down in Austin, and so they see a huge population, and they have given us data as far as some of their pregnant ladies, some of their kids, and some of those things that we're prepared to have should that happen here.
So can you tell us, I mean, I think we as a community need to know if there's the availability within our hospital to take care of very sick children if they get COVID. And there, some of those kids that have the infection that really just gets them. What I have been told, and again, you're the specialist, you're from the hospital, you're the one who gets to let us know for sure, but that there's 2 spots at the hospital for our pediatric care. Every other kid has to be flown out to children's.
That's not a true statement.
Okay, can you tell, is it 5, is it 10?
No, I'm not authorized to tell you the numbers, but we have more than 2.
And there's 17 current hospitalizations with COVID?
I believe that's the Panhandle number.
Okay, but at Scottsbluff?
No, that's not our number.
Okay, what's our number?
I'm not authorized to tell you our number.
Okay. So there's 17, and that's up 6 from just last week, is that correct, in hospitals?
No, it's been 17 for a while. So that fluctuates every day. Makes them lose in. You look at the ICU numbers are lower than they were. You looked at when they did the directed health measure on August 30th. They said we're at the same capacity statewide as what we were at our peak of COVID. But we were at a third of the COVID numbers that we were at our peak. And so that's why they put the directed health measures in, limiting certain things for hospitals across the state because they didn't want the capacity to balloon because it's normal things. We're overrun by the normal things, the heart attacks, some of the other surgeries that were put off last year, we're catching up with, and that's across the
Is there
state.
any specific area outside of Scotts Bluff that we should be monitoring? That, you know, if their numbers drastically change, that we have to say, hey, we better get prepared for this?
So the areas that I watched the east side of the state, of course, because it usually comes back across there. We watched Denver Front Range area, and then Rapid City is what we watched. We watched the Cheyenne, they got overrun a little bit early than the Front Range did, and then they've had a sustained peak. If you look at national data, the thing that people worry about is death rates with things. And so COVID spike with death rate in Florida, they mirrored each other. If you look at some of the other states with higher vaccination rates, it seems 62% seems to be the magic number. Their death rate stayed low despite a high peak with COVID. And so in Nebraska, we're at 51% or so. So we're expecting a higher peak on the death side of things.